Ladies and gentlemen, welcome to the MedTech Impact Podcast, where you get to hear from leaders and innovators who are shaping the future of medical technology. I'm Kyle Cruz.
And I'm Richard Meiklejohn.
And we're your hosts of the show.
So today on the MedTech Impact Podcast, we're delighted to be joined by Greg Englehardt, Global Sales Leader with Imricor. Greg, welcome to the show.
Thank you guys so much for having me. Been listening to your podcast for a while, and it's an honor to be invited on this. So thanks very much.
Well, we are equally honored to have you on because we were chatting a bit offline before we came on here, and you've got a few stories to tell. So yeah, excited to unravel some of them and obviously share with the listeners everything exciting that Imricor is doing. Before we delve into all that, though, we do like to set the stage for the audience. So, what is that big problem that Imricor is looking to solve?
Yeah, we're actually trying to solve the same problem a lot of people are, which is drive better patient outcomes for patients that are suffering from arrhythmias, right? That's the big problem, patients suffering from arrhythmias. But we're doing it in a new way. We're doing cardiac ablations inside the MRI. So why? Because the problem with current technologies today is you can't see soft tissue in an X-ray lab. So you can't actually see exactly what you're doing, and you can't see the treatment that you've applied to the tissue itself. So at Imricor, doing ablations in the MRI solves the problem of really being able to see what you're doing.
And so this type of procedure is pretty common now. People will go in and, they can be released even the next day. And so what's the sort of volume you're seeing, though, in terms of this getting done currently?
Yeah, so this is a massive market. Right now in the US alone, it's a $4 billion annual market. So you're talking about, this is a massive market. The biggest players in the world are in it: Medtronic, Abbott, Johnson & Johnson. Go down the list, they're all in this market. And the reason why is not only in the US is it a problem, but cardiac arrhythmias worldwide are a massive issue.
And you mentioned, so big market, big players, all keen to, again, what you said about having the patient outcomes improved, but just to sort of dig into that underlying problem. So if you can't see what you're doing, what are some of the negative outcomes you get from that?
Yeah, so right now, the challenge of not being able to see exactly what you're doing is you need devices, more devices, expensive devices to be able to give you kind of that idea of what you're doing. And they do that through electrical mapping. They do that through, using certain catheters to give electrical mapping. They do that through ultrasound catheters. So super expensive catheters they put in with ultrasound on the end of it so you can kind of see what you're doing. But even all of that doesn't give you exactly what you're doing and how you're doing it. Okay. One of the problems with current technology, and it doesn't really matter if it's radiofrequency ablation, cryoablation, or the new kid on the block PFA ablation, is a short-term efficacy rate in, let's say, atrial fib, which is the most common type of ablation done, is around 70%. So 30% of patients are not being cured the first time around. As you go out to 5-year data, that number reduces to like 50% or worse. So you're talking about half the people out there within 5 years have to have a repeat procedure done. And one of the key reasons why that is because you can't exactly see what we're doing. And as a hypothesis of ours, of course, this is not a medical claim, but by being able to do it in the MRI, seeing that I'm ablating exactly where I want to ablate and that the treatment that I'm delivering is complete, that we'll have better patient outcomes. When you get to a treatment or a disease state that's deadly, like really deadly, like ventricular tachycardia, the treatment, the success rates are sub 50%. Even short-term success rates are sub 50%. And that all is because you can't see where you want to ablate. So the problem we're really trying to solve is how do we increase better patient outcomes to reduce the number of procedures people need to have and drive long-term better quality of life for these patients. This also brings in about health equity. And I listened to one of your podcasts where you had Jeff DeLulu from Philips on the podcast, and he was talking about that's one of their big missions. It's exactly what we're trying to do. If we can reduce costs for the initial procedure as well as reduce the number of procedures someone has to have, you're talking about reducing burden on the entire market, which allows you to expand your market, allows you to treat new people and treat more people, individual patients, and therefore delivering better care, not just here in the US, but in Europe, where we're currently commercial, as well as other parts of the world as well.
Mm. Yeah, and additionally too, Greg, it sounds like there's an opportunity to perform these procedures in a less amount of time, right? So to your point about health equity, I mean, you're saving time, so now you can even treat more people in a
Yeah,
day, right?
yeah, exactly. So one of the things is when you put a patient inside an MRI, and this is kind of a weird concept, right? Whenever I tell people we're doing procedures inside an MRI, they look at me like I'm crazy until I show them a picture of someone actually inside the MRI being treated. And then they go, "Holy cow, you are actually doing this." I'm like, yeah, we are doing it. But the beauty of it is when we put a patient in MRI and we run the MRI, and we're running it live during the procedure,
Mhm.
I can see if a patient has abnormal anatomical structures in their heart. I can see if they have a ridge, and we can see if they have a pouch. The electrophysiologist can say, "Hey, I really need to pay attention to this area. There's some disease here," because an MRI will actually allow you to see different substrates, so different tissue characteristics. We know which ones are diseased, which one's healthy. They can see this, and then they can pinpoint it because they can see our catheter in the MRI as well, and so they can put our catheter exactly where that disease is. So I was recently at Amsterdam, University of Amsterdam Medical Center in the Netherlands, and the doctor said, "Man, this case in the traditional floor lab would have taken like hours if we would have been able to complete it because of the patient's anatomy." And we were done in sub 30 minutes. So it's kind of interesting that, yeah, we have a potential to save a lot of time in these procedures as well.
Mm.
And that
Yeah.
gets into, we talk a lot about how that works, but, we talked, I brought up a little bit ago about using these different tools like mapping catheters. Well, we use mapping catheters to create a map of the heart, both physically and electrically. Well, we still want to do it electrically, which we can do, but we don't need to do the whole mapping because we can see everything we need to see. So it's kind of a neat solution.
It is. It's really neat, especially because you're leveraging, technology, MRI technology that has, been around for, I mean, decades. But the reality is look at how MRI has evolved, right? Look at the clear pictures, right, that you get from MRI, and every hospital has one, right? And that technology is only continuing to evolve. But it sounds like, Greg, your technology, you're not developing by any means an MRI, you're developing a catheter, right? A catheter solution. So kind of tell us a little bit more about that catheter technology, especially because me working on the contract manufacturing side in the medical device industry, working with a number of technologies that know the challenges, or at least I hear the challenges from my customers about specialty materials and designs and components, right? Especially when these are electromechanical products, leveraging different types of energy and different types of alloys and all of that. You have to be super careful, right? Because now you can create just a ton of different problems can occur. So I would imagine your technology, I'm sure there's probably a lot of ingenuity that and innovation that had to go in that catheter design for it to be able to function and work properly in an MRI. So could you tell us a little bit more about the catheter?
Yeah, so the catheter is a big component of it, but it's not just a catheter. We had to build an entire system. So recorder, stimulator, we had to get partners to help us build defibrillators and RF generators and everything that can work in this crazy environment, right? And the problem is that people always think of an MRI as of a magnet. So you can't have anything magnetic. Well, that's the easy problem to solve, right? So like copper, gold, not magnetic, super easy to solve. But it's everything else in there. How do you put a computer next to a big giant electromagnet and it doesn't, fry it, right? Like we have to solve those problems as well. When you come to the catheter, though, this is really where the science is. It's where a lot of our patents are. It's what the patents, at least we care about, are in. So the initial challenges of building a catheter in this situation is, one, how do you do it in a manner that's safe? And again, making it non-magnetic is probably the easy part. And I know my engineers will probably yell at me for saying that, but it's probably the easy part. The hard part is then, that a lot of people don't think about. And MRI also produces a lot of radio frequency. And we're basically putting 100 and something centimeter catheter into a patient in the middle of this electromagnet, you conduct a lot of currents, and that can create heating. So we had to figure out, how do you prevent this catheter from heating? And so we have special windings. There's a lot that goes into manufacturing this catheter in order for it to not heat. Well, the other problem is then how do you build it in a way that doesn't impact the MRI image? Because if you put any type of metals and things like that inside the MRI, it's going to give you this artifact, which you can't have. So we had to basically make it invisible to the MRI and not heat up. The other challenge was, and we found this out throughout the process, and Steve Woodham, my CEO, wrote a paper on this. But if you put this catheter in there and you're inside the heart, it can actually pick up the pulses of the MRI. So if you've ever been in an MRI, you hear the bump, 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 and it sees gradients switching back and forth. That will actually get captured by the catheter, and you can pace the heart. And now you're talking about pacing the heart at like 8 beats per second or more or less, depending on what sequences they're using, which obviously would kill someone.
Yeah.
So we had to make it not do that too, right? So we solved all those problems. Then the question is, well, if you made it invisible, if you made it not being able to heat up, if you make it so it doesn't capture and pace the patient when you don't want it to, right? Then how do you see it? So we actually worked with Philips to create coils that we actually put inside of our catheter. So we actually have MR receive coils built into our catheter. Our devices plug into the MRI, which allows our computers basically to talk to the MRI computer, and allows the MRI to track our catheters based on these tracking coils. So now we have a system where our catheters are seen by the MRI, by these tracking coils, exactly where they are in real time throughout. So we solved all those problems in order to deliver this technology.
And the reality is it wasn't just one product. It was, you
Yeah.
mentioned maybe 8 different products, and are they all truly like relying on each other when you develop these? Like if one of the products doesn't work the way you need it, it's like, does that impact your overall solution?
Yeah, right. So this is a big question, right? Like
Yeah.
people ask me like, oh, I just need this. It's like, nah, you not really. You need this, 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 and this in order to do it. So if you think about a traditional fluoroscopy lab,
Mm.
everything that's in a fluoroscopy lab in order to do ablation, we need it, but we need it in an MRI environment. So we had to create all these tools. You know, you look at our FDA trial, it's not a catheter that's doing the trial right now. It's, as you said, 8 devices. It's a ablation catheter, a diagnostic catheter, our recorder stimulator, RF generator. Go down the list of all the things you need, and all of those are part of that trial because you can't do it without all the pieces.
And it makes a lot of sense why, Imricor is one of the only, if not the only company doing what you're doing today, bringing the type of technology to market that you're bringing today. And Richard, I mean, when I think about go-to-market strategy, and having such a disruptive technology, and everything going into it, I don't know. I think about, what kind of disruption that would create for the industry.
Yeah, absolutely, Kyle. And I want to bring it back to that hypothesis. And you're saying, you have this idea that this enhanced imaging is going to improve the outcomes. Like, but then you've got to have that conversation with people and, get that buy-in. And so, what's that been like in terms of like going, yeah, we think we could start something like this inside an MRI? I mean, that in itself must be some discussion.
Yeah, right. So Kyle, I would like to say we are the only company in the world doing this.
Okay.
So we are the only one, right? So a little crazy, right? Actually, a lot of the big companies actually tried building this. They failed. We have brilliant engineers at our company, probably some of the best in the world. And so they were able to solve all the problems. And that is really kind of the science behind this, which is great, right? Now it's my job then to figure out, as you said, Richard, how do you then bring this to market? How do you do this? It's a little crazy, right? Well, you and I both know there's a couple of things that drive bringing the technology to market. And that is one, does it really work? And can you drive better patient outcomes, right? Because why are you going to switch the way you do things if the outcomes are the same? No one will do that. But there's a third piece to that that's really important. And that is, can you save money? Right? So the great thing about our technology, everything that goes together, is that we can reduce the number of tools that are utilized during an ablation. So, for example, we don't need a mapping catheter. Those mapping catheters are thousands of dollars, right? We don't need an ICE catheter. Those ICE catheters are thousands of dollars, right? So we can perform an ablation for simple procedures like an atrial flutter, roughly $300 less than all of our competitors. And we talked about, complex ablations like VT. We're talking probably like 3,000 plus in savings. So if you talk about that type of savings on the disposables alone, and the procedure costs alone, and you talk about increasing better patient outcomes, talking a massive cost saving of every facility that could reach millions of dollars a year.
Yeah, and I think the other thing you touched on there was, that feedback you were getting about how much time you're saving potentially in a procedure. Because, another thing that was highlighted in that report from Philips was about the burnout of healthcare professionals. And so the fact that you could offer something that could potentially reduce that burden and give people, a more efficient procedure, I think that's huge as well. And clearly you're going to get great feedback.
Yeah, it's that there's a lot to that too, right? And that resonated when Jeff said that, because I see it particularly in Europe right now. It's really tough in Europe. There's a healthcare shortage, not a lot of nurses. They're burning out really high level. And all this is because of the impact of the pandemic. We see it, right? And it's been interesting. When they do ours, it's something new. They can actually, everyone in the room can see what's happening. They know what's happening, so it kind of brings the whole team together, and they're all working as a team in order to make this work. It's really great. The part that we talk about is, look, if you have a straightforward case, yeah, we're not going to save time. It's going to be the same. It's the cases where the patient have bad anatomy, maybe they've been treated before. The complex procedures, that's where we'll save the time, right? It's not that super straightforward case, but you don't know what case is going to be straightforward and which one's not in a fluoro lab because you can't see the patient's anatomy where we can, right? And that's the biggest difference. The other part about when you talk about staff and you talk about burnout and safety and all that, we eliminate all radiation, right? All the big companies are going to kind of less radiation or minimal radiation. We have no radiation when we do our procedures because we're in an MRI room, right? So our doctors, when they're performing our procedures, they're not wearing heavy lead. All the studies show that electrophysiology is one of the highest levels of occupational injuries. Again, orthopedics and spine too. So you got to think about these procedures that use a lot of fluoroscopy where they have to wear this lead. They have neck problems, shoulder problems, spinal problems, right? Something that came up that I never thought of before. I was talking to a brilliant EP at a convention. She was telling me how she's not operating anymore. She's only seeing patients and she has to refer her patients out. And I asked her why. She said, because I want to have a family. Right. So now she can't practice because she's worried about her reproductive health, being in that X-ray environment and exposing her baby to X-rays. Right. And so she's worried about that. So again, we're not just talking about better patient care. We're talking about being able to also deliver a better environment and a safer environment for staff and physicians.
And in terms of the product being available right now, like what's the latest status quo? Like where is it available and who's using it?
Yes, it's great. So first of all, we're in the middle of we just started our US FDA trial. So one of the cool things that I get to do, what I love doing, building sales teams. This is my fourth startup. This is the first time I'm actually going to build one from the ground up. But again, this is number 4 for me. Luckily, the first 3 were good. So hopefully the fourth one is too. But I get to build a sales team, which I'm really excited about. We're in the middle of our FDA trial. I'm hoping that we launch here in the US sometime next year. Probably back half of next year is where we're hoping to launch. Of course, you never know with the FDA and the approval regulatory process, but that's kind of where we're looking at. We're commercially available across the EU, so we actually have hospitals in 8 different countries using our technology. So, of course, the big ones you would expect, like the Netherlands, Germany, right, France, Italy, but we also have hospitals in Croatia, in Dubrovnik. Also in Semmelweis University in Hungary. So we're expanding there. I've recently launched a distribution sales team in the Middle East. to cover Saudi Arabia and Qatar, and we'll expand to other countries there. And we're waiting on TGA approval to launch our products fully in Australia and New Zealand. So we kind of have all that going on, and I've got about a year left to get those all launched and rolling before we start the US. And then, of course, my shift will focus to building a US sales team, which business-wise is probably the best market.
Amazing. And you said now that you're working on your FDA approval here in the US. What does that kind of regulatory pathway and that approval process look like? You know, since this is new, what type of FDA approval are you going for?
Yeah, so you can't do a 510K, right? You have to do a full top to bottom de novo trial. So Hopkins is our lead US hospital. So it's great to be working with a world leader like Johns Hopkins to be able to deliver this. But because of the reduced number of labs that are available worldwide, we actually do have sites in Europe that are helping supplement the data and treating patients to bring in, which graciously the FDA approved in order for us to get to the patient volumes they want. Again, we're doing something different. We're doing cardiac ablations inside of an MRI. There's a few sites here in the US that could allow for that. There's a lot being built right now, which is what's exciting because everyone kind of sees the future happening, but they're not there yet. So we'll get there. But yeah, so Hopkins. So we've got to do a full study. We've got to do follow-up. We've got to do that again. We're hoping that to complete that in the next few months, then when obviously we'd submit to the FDA. And as we highlighted before, it's not one catheter, right? It's multiple catheters. It's RF generator. It's a recorder stimulator. It's we have a mapping system, so we had to build an entire mapping system from the ground up. Cool thing about that is it's not catheter based; it's MRI based. So yeah, we can do all the electrical mapping you want with our catheters, but the actual shells and the creation is all done with the MRI images. So it's a true representation of exactly what you're seeing. So it's pretty neat stuff, and something we're really proud of and something that's really resonated. So it's a bunch of systems all together, both hardware and software, that we're going through this regulatory process. And our regulatory team is fantastic. Jen Wise, our leader there, she's doing a great job. You know, her background, she came from Medtronic, so she kind of knows this pathway, but we're doing a full brand new submission, and we'll be the only ones that have it.
Wow, that's incredible. And I think what's really cool too and unique is that I personally, and we've had a bunch of people on this show that are bringing new innovative technologies to market. I've never heard of them being able to leverage Europe the way you're leveraging Europe and how FDA kind of approved that process, you know, to assist in those efforts. I think that's really neat. That's fascinating to me. And I'm sure it would probably be fascinating and interesting and just be seen as a really creative out of the box way, maybe for other companies that are developing, you know, super new innovative technologies, you know, that where there's a will, there's a way. And I'm super curious too, what's been the response from all of the, you know, surgeons or physicians that are using your technology so far?
So again, the ones that are using our technology love it because they can do procedures in a predictable way. They don't have to wear the lead. They're safer. Their patients are safer because their patients aren't getting exposed to radiation either, right? They're seeing great outcomes. It's fun. Like I don't want to say fun, but they always tell me, yeah, it's really neat to do this in the MRI. Like they like doing it in the MRI. So we're seeing that kind of traction, particularly, you know, obviously in Europe. The really neat thing about that though is that uh, this last year, we've really seen an uptick in interest across the globe because people are hearing what we're doing, right? And they're starting to see it. And this year at European Heart Rhythm Association, I was also at an MRI conference, so cardiac MRI conference that was in Europe, and at HRS this year. I had so many doctors coming up to us saying, "We're watching. We can't wait till you're here. We're excited." Like the fact that you guys are going to be doing a VT ablation is amazing because most technologies, they'll start with atrial flutter like we did, no different, right? Because it's a pretty safe procedure. You can show that your technology works and perform an ablation in a safe and effective manner, which is what we did, right? Well, then a lot of people will go to AFib, which is in the left atrium of the heart. And again, it's the biggest market, but you got 5 or 6 really big players going after that market. Then you have VT, right? So a lot of people don't do VT ablations. And the reason why is because they're not successful in a traditional fluoro lab. We're talking published papers that show 30 to 50% success rate. So we're talking about a procedure that is not successful, right? Let's just be honest. Like, would you sign up for a procedure that's, hey, we got a 50-50 shot if this is going to work or not? Now the problem is you don't get it done, you probably die, but that's horrible. Or you get an ICD, right? So you got the implantable defibrillator. The problem with an ICD, which is great technology, doesn't treat the disease. It only treats the symptom, right? So your heart goes into VTAC, your ICD shocks you, you go back into normal rhythm. It doesn't treat the disease. We want to treat the disease. So people don't have to go through that, right? So that's the response we're getting. Every physician we talk to, and I mean every physician, goes, if you can really do VT procedures in the MRI, this will change cardiology. They see it, they understand it. It's why our initial hospitals, like in Leipzig in Germany, Hopkins, all them built these innovative MRI suites before we even had approval to do these type of things, because they see where this is going. And now it's our job to make sure that we prove it, right? And then it's my job to sell it. Sometimes easier said than done, though, right?
Well, it sounds like you're going to have a few doctors signing up who could be good salespeople for you, given the feedback you're getting. But my mind is just blown away by the complexity of like what you're addressing here. I mean, when I think about challenges, I'm like, clearly you just got like a huge list that just rolls off the table, because like, where do you start? But I wondered if you could think about, turning an MRI environment into an OR. I mean, what's that been like? Because that's a kind of transition in itself.
Yeah, that's pretty cool, right? So one of the first things I thought was interesting as I got into this is how do you, like, I knew nothing about MRIs. This is my first world in MRIs, right? I've done both surgical and diagnostic products in the past, but nothing like this. I don't think anyone's done anything like this. This is a different level, right? So I'm always kind of amazed that we're actually able to do this, but we've done such a good job from a technology standpoint, and an understanding standpoint to make this work. So one of the things we have to convince people to do is, how do you build an MRI suite that function as an EP lab or as an operating room, right? We've now helped build a lot of these, which is great. This year actually helped a site here in the US build one of theirs. There's a couple others that we're helping them design theirs as well here in the US. And of course, in Europe, we've been hands-on a lot of these suites. The interesting thing that is even if a hospital has an existing MRI, we figured out how to even convert those. So they don't necessarily have to build a brand new suite from top to bottom. We can modify existing suites. So we've had to have engineers, we've architects, everyone kind of come together from not just our company, but from the big companies like Siemens, Philips, GE. And the great thing is we have partnerships with those three big companies. So we have joint development agreements, even some sales agreements with those companies. So we've kind of pulled the biggest and best MRI manufacturers in the world into what we're doing. Now, when you talk about building an iCMR, so an interventional cardiac MRI suite, everyone thinks it's going to be so much more expensive than building a traditional EP lab with a fluoro machine. The reality is it's not, right? So we need the MRI and our equipment, a couple screens, that's it. You go into a fluoro lab, yes, you need the X-ray, which is less than an MRI, but not much less. You need that. You need the table, you need the lights, you need the screens, you need everything else that goes, all the lead, all the thing. There is not a big difference between building an iCMR suite or a fluoro suite, and kind of depending on how you do it, might even be less. So again, once we get into that type of discussion with the hospital, they're really surprised of how easy it is to do. Of course, it's a project. It doesn't happen overnight. It takes about a year to 18 months. But we've done it enough now to where we know that process. We know how to do it. We can help hospitals design these in a way that's safe, effective, works with their current environments. It's actually pretty neat.
I mean, clearly there's an economic argument for doing it, because you're going to get return on that investment by creating this, and it's just kind of intriguing because potentially you're opening doors to other types of procedures that haven't been applied or thought about before. But also then you touched on the economics, and I'm thinking, like, how much money is it taken to get this technology to where you are? Like, just it must be hundreds of millions, because you've been on such a long journey, and again, you've talked about how nobody else has been able to do this.
Yeah, so that's a great question, and your assumption is not actually accurate. We've actually raised a lot less money than you think. Well, I'll talk about that, but I do want to say one thing, that the MRI iCMR lab has a lot of value just in performing these procedures. But as you highlighted, there's going to be new procedures coming down the road, like doing cardiac biopsies inside the MRI, which means I can see the tissue that I want to biopsy and I can biopsy the exact tissue that I want. Right now, they don't do that. They just go in and grab a bunch of things and hope they get what they get. We're actually going to do targeted biopsies, something we're working on, which is exciting, right? And then there's going to be other treatments down the road. We just happen to pick cardiology to start, probably the most complex, but we could do liver, we could do lung. There's so many different things we could do because we know how to make things safe and we can apply it to this environment. The other value of having an iCMR that from a hospital's perspective is if you go into a hospital and they work in an EP lab, they open that thing at 6 in the morning, kind of 6 p.m. It's kind of done unless there's an emergency. Doctors go on vacation, it's closed, right? Lights are off, everyone goes home. You have an iCMR lab in a hospital, you still have an MRI. So you still have an ability to diagnose patients, to use it as a traditional MRI. So you have the value proposition of having an MRI that can do high-end procedures on top of that. So the value proposition is fantastic. When it comes to investment, I don't know how our team has done what they've done with the investment that's come in the door. We haven't burned through 200, 300 million like you would think we have, even with 8 products. And we've seen companies go through 300, 400 million just for one product. As a startup, we all wear multiple hats. We don't know what nights and weekends are, right? You do what you got to do to get the job done. You do it on a shoestring budget. And more importantly, do you have the right people? And the team we have together, from our senior leadership all the way down, are brilliant people that all get it. And they work hard. They're ultra focused. We don't waste money. We don't waste time. We do everything we can to make sure it works. And that's how we've been able to do it without the hundreds of millions of investment in it. Now, of course, we've raised a lot of money, but not like you would think.
Well, Greg, I think what's really cool too is just kind of hearing everything you guys also have going on in the next 6 to 18 months. Obviously, you hit on a number of milestones. You've got some great partnerships in place. It sounds like, you're going for that FDA approval here in the next, say, 18 months. You've got a stellar team. It's remarkable. And you've had these incredible experiences. You've been with a number of early stage technologies and you help them, maximize and to help them realize their potential. And those technologies now are improving, saving millions of people's lives. So there's a lot, of experience that you have. And, a big piece of the show is kind of the reflection side, right? And, with your experience today, what's maybe, a couple pieces of advice that you would have for, say, anyone that's, looking or interested in bringing such a disruptive technology to market? Kind of like what are the key areas that they should be focused on, and what advice do you have for them?
Yeah. So first of all, when you do this journey, you're going to make a lot of mistakes. I've made a ton of mistakes, right? Especially during COVID, no one knew what was going to happen. We kept saying, 6 months, this will be gone. We can go, right? So we don't need to change our projections, or we don't need to do this. Like I wish I could go back to when we launched our technology in February of 2020. Literally, I was in Paris doing some of our very first commercial cases when the US shut down its border, and I had to get on like the first plane out of there. And then from there, we were trying to sell our technology and get people to use our technology over the phone and over video. Can you imagine that? And the fact that we actually got people to do it was crazy, right? But we made a lot of mistakes. And when I talk about mistakes, I'm not talking about mistakes with customers. I'm not talking mistakes in our selling methods or anything like that. I'm about business mistakes that if I look back and reflect on that I did. And one of the things I can tell people is factor in the delays. Because every company I've been with, it's always gone longer and taken more money than you expect. And I know everyone says that, right? But it's real. It's totally real. 2 is sometimes I think we have a tendency, particularly as a salesperson, to paint the glass half full kind of picture, right? Like it's going to be okay. We'll figure it out. Like, yeah, I'll hit that number. We'll do this. We'll do that. Because it's what we're used to doing. And the reality is sometimes it's just not. possible, right? So you got to be really honest with yourself on what's possible and what's not possible, and make sure you set the right expectations. And I think sometimes as salespeople, we tend to set the expectations that are here, and we probably should be setting them that are about here, right? Not down here, but we should be setting them here, right? And I think that's something that over the years, particularly the last couple of years, I've gotten a lot better at. And so, and when I talk to other people that have been in my shoes of building businesses, kind of growing things, it's one of the big things I hear is how do you really kind of have set realistic expectations? And I'm not talking just for your sales teams. I'm talking about for your leadership, right? And for your investors and for everyone, how do you do the right thing and how do you account for all these variables that you don't know are going to happen, right? Because you don't know what you don't know when you're launching a brand new disruptive technology. And that's kind of the thing is you got to be ready for everything and anything that comes your way. You got to figure out how to get around them, go over them, go through them, whatever. And that's what we've been able to do. Kind of what I've learned over the years.
Yeah, well, I think that's great advice for everyone. And clearly, again, you touched on the mistakes get made, and I think removing that barrier to fear that if you're a young person coming into sales, you are going to get everything right from day one, and so you've got to
No,
persevere and you've got to learn on the way.
yeah, right. And we talk about having an impact on the world, really having an impact on as many lives as possible, which is why personally I'm in the role that I'm in. I love being able to impact patient lives, and I think it's important that we do that in a positive way. We're going to really change how these patients are treated, and I think that's really kind of the opportunity that we have in front of us.
An exciting time to be joining Imricor, given what's ahead of you, and clearly you mentioned you're going to be growing your sales team, and I just kind of wondered if you have like a piece of advice for anyone who is growing a sales team, like what's that vision you paint so it's not just about the numbers, but it's about that bigger picture you're referring to.
Yeah, I think you got to find people that are going to believe in your story and are willing to push through the tough times. Because as you launch a technology, it's not easy, right? Like I said, I don't know what nights and weekends are. Like we're going holidays, our phones are still on, right? Um, it doesn't matter. We're pushing through. You got to find people that fit your culture and that can do what you need them to do. I think so many times we find this person, they're great, they've had success in the past, but they don't necessarily fit the culture. We hire them because of what they did. They're not really a fit, and it doesn't work. You got to find people that are going to work in your culture that you've built, that are driven, understand your story, and believe in your story. They're passionate about what you do, and they're willing to do what it takes to get the job done. I want to build a culture that's driven on rewarding for success and really making sure that when we say 100%, that's the bare minimum. When we go after that 105, 110, 115, 120%. I really want people with that mindset. And as you're launching a business, you really need to have people with that mindset that think that this is an old mannerism from many years ago, but a day is a week is a month is a year, right? If you have that mindset that, hey, every day is impactful, every day I need to accomplish something, and really move the ball forward, you're going to hire a team that really kind of is going to help you move forward quickly.
Yeah, Greg, that's awesome, man. So where do you see Imricor in 5 years?
Yeah, so I've been asked this actually a couple of times recently. I wish I had a crystal ball. I don't. Uh, Here's the reality. I see us impacting patient lives through doing both simple procedures as well as complex procedures, right? Being able to treat a lot of patients with arrhythmias in a way that no one else can, and in a market that we've changed and that we're taking over. The reality is that if we can, and again, our VT trial that's happening, the visible VT trial in Europe, doing VT ablations and complex ablations will change how these patients are treated. We'll create a gold standard by completing this. And so my vision for the next 5 years is being able to create that and have a product that is truly the gold standard for how we treat patients with arrhythmias. All the other stuff to me, really not as important. That's what I'm going to go to.
That's perfect, Greg. It's fantastic, man. I mean, you guys are true disruptors. You truly are bringing an innovative technology to market here. And, all eyes are on you and Imricor. I'm sure there's going to be a lot of interest generated throughout the entire industry over those next 5 years. So it's going to be exciting to watch you guys grow and flourish, and it'll be exciting to see where you guys end up. So, hey, how do people get in touch with you? I'm sure there's a lot of folks out there that might even want to join your team and help you grow Imricor and help, obviously, doctors and physicians have better technologies to treat their patients. So how do they get in touch with you?
Yeah, so not just for me, but our entire team. We're always looking for the best and brightest, right? And throughout. So I'm on LinkedIn. You can find me on LinkedIn. I also have an X account, so you can find me there too. It's both business and personal. So hit me up there. You could also find me on our company website, imricor.com. So that's IMRICOR.com, or my email, greg.englehardt@imricor.com. Reach out anytime. Love to hear from you. If you have questions about what we're doing, how we're doing it, if you have interest in joining our team, whether you're an engineer, salesperson, whatever, please reach out. We'd love to hear from you. And we want the people to help us build the path forward.
Well, this is the time for people to be getting in touch, because clearly you've got an exciting path ahead of you. So thank you again for coming on the show and filling in the listeners and all the things that are happening at Imricor, Greg.
Thanks so much for having me. It was great to be with you today, Richard and Kyle. And you guys doing great things. Love your podcasts. I keep doing them. And hopefully we get to do this again. It was a lot of fun.
Awesome. Well, ladies and gentlemen, another huge thank you to our guest, Greg Englehardt, Global Sales Director at Imricor. And thank you for tuning in to another episode of the MedTech Impact Podcast. I'm Kyle Cruz.
And I'm Richard Meiklejohn. Until next time, keep innovating.